Right, welcome to this HP3 webinar, and today we're joined by Kate Disley from Momentum, and we're going to be chatting through why and how Pilates-based strength and conditioning can fit into an endurance athlete's training plan. So Kate's a sports rehabilitator and soft tissue therapist with over 20 years experience. She's got a background in elite sports and a strong interest in biomechanics, and particularly running performance. And she teaches Pilates, both for back pain in clinical situations and also for endurance athletes, including runners, cyclists, and triathletes, just looking to improve their performance. So hopefully this can be a very practical conversation for everybody wondering whether Pilates deserves a place in their training week. So Kate, obviously you and I have known each other for a rather long time now, so over 20 years. And in fact, it was down to you that got me into the sort of sporting world in the first place, getting my first job with a rugby team. And then, I've sort of helped you with some of your clinical roles over the years. So, we've had a really, really good relationship. But let's talk a little bit more about Pilates specifically. And do you want to maybe just introduce yourself and maybe how you've been drawn into doing Pilates alongside your sports rehab?
Yeah. As Tim pointed out, I've been working clinically for 20 plus years, doing a mixture of kind of sports massage initially, a little bit of Pilates stuff, and then I've kind of moved more into kind of sports rehab, running biomechanics in the past kind of few years since doing my MSc. So I started off doing Pilates initially because I was actually injured. So I was playing high level rugby, doing loads and loads of weight training. And then I had a labral tear in my hip, which just kept constantly causing me issues. So I had to kind of wind down a lot of the kind of high level stuff, the impact, the loading, change of direction, and just tried to manage it conservatively, and took up Pilates essentially. So I kind of came in it from an injury perspective rather than a performance perspective. But as soon as I got to that first session, I realized how blooming hard it was, and how bad I was at it, which was a bit of a shock because, I was doing a lot of other really good high level athletic stuff in the gym and on the rugby pitch. But I really, really struggled with some of that kind of lower level single leg control and stability work that other people in the class, twice my age, found really, really easy. So it was a really big eye open for me personally, and also kind of clinically, seeing that there is that kind of other level of strength training that, I was clearly missing out on. And even to this day, that's what I see clinically as well, is like, fit, active, healthy people who are able to achieve loads at a high level. You kind of break it down into those smaller, kind of more isolated movements, and they really, really struggle.
100%. And I can relate to that myself. Again, high level sport, but then class and, tutors come along and just sort of fine-tuned a few things. It's like, oh yeah, that's challenging. Or if I do one of your videos, we've got a range of videos for our HP3 athletes, and when I just pick up one of yours, and it's like, oh yeah, this is really challenging, and that's often maybe a misunderstanding. So I suppose that leads me nicely into my next question, which is, what's your experience been with working with endurance athletes, and when they hear that sort of phrase, oh yeah, let's do some Pilates, what their impression of it is and what they usually get wrong?
Yeah, I think it's probably like my initial impression that it would be easy. It's easy, low level. Like, why do I really need to do it if I'm already kind of doing all these high level things? So yeah, I think Pilates gets a bit of a bad rap. It's kind of pushed into that box of kind of, windy church hall, lying on a cold floor with a load of old ladies, just kind of rolling around. Yeah. Whereas in reality, it's much, much harder than that. So yeah, a lot of the kind of performance Pilates stuff that I've done over the years, it tends to be the males. I tend to have a lot of males who come to my performance Pilates class because it's labeled performance Pilates, and I give them a bit of band. And they're the ones that kind of find the most benefit from it. I think, females are generally much more open to a lot of different ways of training, but males kind of end up pigeonholing themselves into these kind of really high level programs without doing many of the basics first, and that's where they kind of tend to struggle, end up getting niggles.
And that's it. It is about laying those foundations and those basics, the movement patterns, isn't it?
Yeah.
I've worked with, people with Olympic medals to their name, and they can do some really, really high level movements. Gymnastics, trampolining, things like that, and then you get them to do some fine tuning with some Pilates movements, and they struggle. It can be a real eye opener.
Yeah.
So maybe we're kind of getting ahead of ourselves here. Let's kind of go back a bit. And for somebody who's kind of very new to this or hasn't done a class before, what is Pilates?
So it's a kind of low impact form of exercise. So it kind of originally stemmed by this man, Joseph Pilates, who kind of had a bit of a dance background and came up with kind of, these set key movements that he felt that every dancer and every athlete should be able to do. So they are really, really high level. So the courses that I've done have been run by the APPI, so that's like the Australian Physiotherapy and Pilates Institute. And what they did is they kind of used those kind of key elements and key exercises from Joseph Pilates, and they kind of refined them and made it much more applicable to a clinical setting for, especially kind of physio and rehab stuff. And they kind of have like a graded level approach to the exercises. So you start with your level 1, and then you can kind of work all the way up to level 5. Joseph Pilates exercises are all level 7 and above, which for us just normal people is a little bit unachievable. So it's using kind of like really simple movement patterns. You kind of, your hip stability, shoulder placement, your head and neck, your posture, and like functional movement patterns that kind of then can lead into kind of more weighted and higher level exercises.
And then, so how would you then explain that to somebody who's very skeptical to this? So how are we going to sell this to your skeptical runner or cyclist, triathlete? Why should we do these simple movements?
They just make you move more efficiently. Yeah, efficiency is key, especially in kind of performance terms. The more efficient you are, the less likely you are to fatigue. And, fatigue and injury really well linked together. So, if you're going to move more efficiently running, that transfer of load through the body, especially even on the bike, if you can be more efficient and more biomechanical, losing my words, biomechanically efficient, it's going to just pay dividends. Yeah, it then also means that when you do go into lifting in the gym, doing the heavier, more loaded stuff, you've got that basis of movement patterns, that neuromuscular control already there. So you probably find you can load heavier than you were previously.
Yeah, and again, we've seen that with just gym programs where if you have a block of time where you just come away from the heavy lifts and really work on those foundations, you can then suddenly come back into the higher lows again and actually go up another level because you've just strengthened those foundations.
Yeah.
So what does that sort of really good Pilates training develop that maybe a standard gym session or gym program sometimes misses?
I think there's obviously a lot of similarities. Yeah, we are essentially just doing the same movements, just in a slightly different way. With a lot of the kind of Pilates stuff that I do and start with, it's mainly mat based. So again, it takes away that risk of kind of the loading positions. It kind of gives you a little bit more feedback about where you are in space. So people tend to find that a lot easier to kind of gradually expose themselves to. And when I was first taught how to teach Pilates, we kind of had like these 5 key areas, the key elements of Pilates that we kind of focus on. And some of them are kind of moved away a little bit from, like kind of, engaging your deep core muscles and things like that, because, research changes over the years and we now know that that's not really that necessary. In some instances, we do still need to think about that. But a lot of time for me, it's kind of thinking more about your breathing. Yeah. Being efficient with the breathing, relaxing into the breathing, your rib cage placement, making sure you're not flaring, and we're kind of not overloading certain structures in the body. Again, it's just that kind of movement efficiency, I suppose.
100%. Is that the posture, proprioception, that awareness, that body awareness,
Yeah.
and just slowing things down a lot.
Yeah.
If we can do things slowly with good control, then we can do it fast.
Yeah.
But maybe sometimes it is just slowing things right down can really expose areas of weakness that maybe we didn't quite realize that we had.
Yeah.
So, okay.
Which is generally where I would tend to get people to breathe. So a lot of people breathing is about, the movement of the rib cage and like getting the pelvic floor to engage, which yes, it does. But for me, I will generally use it to get people to slow down.
Yeah.
Yeah, slow down, think a little bit more, and kind of get that control rather than holding your breath, bracing and doing it as fast as possible.
Yeah, exactly. Because then you can't rush the breath because then it all starts falling apart.
Yeah. And especially with especially female athletes, thinking about especially return to running and return to lifting after pregnancy. People have got any pelvic floor issues. A lot of it is about that kind of pressure control and management and your rib cage placement. So it also kind of fits really nicely into that bracket of kind of getting those kind of endurance athletes back to doing endurance sport after pregnancy.
Yeah. Exactly. But then another sort of common question, I guess, I don't know whether you get it as well, is, what's the difference between yoga and Pilates? Should I do a Pilates class? Should I do a yoga class? What's the differences? What are the similarities? So how do you see it from your side?
So I don't really do yoga. I did one session of it and I really didn't like it because I wasn't very good at it. And I only do things I like and I'm good at. No, I think really the way I kind of describe it to patients in simple terms is that yoga is more about range of movement and flexibility. It's like working within your full range, trying to get into it, hold it, stretch it, which for some people is great. However, there's a whole different cohort of people who are already really mobile, who probably don't need to stretch and they probably just need to stabilize more, which is when I've kind of pushed people more towards the Pilates side of things, getting that strength through your full range rather than just stretching in your full range.
Yeah. And I think you sort of touched on a key thing there. You enjoy Pilates, you don't enjoy yoga.
Yeah.
I probably do more yoga sessions than I do Pilates sessions at the moment because I need the flexibility work. But an interesting one, I had a PhD student a couple of years back looking at yoga and Pilates because she taught both. And her demographic was very much more the older individuals, so not sporting. But one of the key things that came out of that was it was personal preference. If you enjoy Pilates, you tend to do better with Pilates. If you enjoy yoga, you tend to do better with yoga. They can both achieve essentially the same thing. It's just from different avenues. So it's worth trying both.
Yes.
And seeing which one you enjoy.
Which one do you enjoy? Which one makes you feel best? Which one are you actually going to commit to and be consistent with? Because again, it's that consistency of doing anything is better than doing nothing. So
absolutely, because they can complement each other rather than to compete against each other. I think that some of the confusing things between the two can be the breathing, as you mentioned there. That there's a lot of sort of breath control around Pilates. There's the same breath control in yoga, but it can sometimes be the opposite way around in terms of sort of breathing in with the movement or breathing out with the movement. That can sometimes confuse people.
And again, and different teachers will teach it differently. Like I've done the same qualification as quite a few other physios and clinicians that I know, and I've been to their classes, and their classes are really different to mine, even though we've all done exactly the same training. It's that kind of individual take on what you've learned and how you implement it, and then does the individual like your session, think it makes them feel better?
That's it. And as with yoga, where there's lots of different styles of yoga and approaches to yoga, there's different styles within Pilates as well. And you just touched on that. It depends on the instructor. And whenever any of my athletes do one of your classes, they always then come back and say, oh, that wasn't just a really kind of not sort of voodoo-y, but that sort of, it was a sort of spiritual type class like a yoga would be. That was a workout. That
Yeah,
was that was a tough workout.
yeah, which is very much my personality.
Exactly,
So,
exactly. So it's finding the right instructor for you as well, isn't it?
yeah,
So
yeah,
if somebody has maybe tried Pilates, didn't really get on with it, maybe it's not Pilates, maybe it's just the instructor, and you need to try something different.
yeah.
And if somebody does want a much more relaxing type workout, maybe you're not the instructor for them.
Well, my performance class isn't.
Yes.
I do teach a nice, relaxed back pain class with a group of kind of more elderly patients, and that is much more mobility based. Yeah, we don't do loads and loads of single leg standing and planks and side planks and things like that. It's tailored.
Yeah. And the clinic I work out, again, a lot of the Pilates sessions there are more heavily on that sort of clinical rehab
Yeah,
basis as well. But then another sort of theme or style to Pilates is the reformers, and that's
yeah.
having another resurgence in this last sort of 6 months, 12 months or so. They were sort of popular a while back, and then they seem to sort of die off. And it just seems to have another little boom.
Yeah, huge.
So
Yeah.
what is reformer Pilates then?
So I've never done any. I've never trained to teach reformer Pilates, but I have
Okay.
done a little bit myself previously, and it is good. It's just very different. So a reformer is basically like a carriage that moves. Yeah, it moves, and you can add resistance onto it through different kind of coloured springs. So you can vary the resistance. So it's much more about resistance training rather than kind of just the movement and control stuff. There's lots of people that enjoy it who have had kind of hip and knee replacements because you can change where you're putting because there's also kind of straps on the arms and legs that can you can change the position of those, you can change the resistance. And so a lot of people think that the reformer stuff is harder because you get the resistance, but then there's probably a whole cohort of people that actually find it a bit easier because you're getting the feedback as well. So again, it's kind of, personal preference, I would say, as to which one is best.
Yeah.
Yeah.
And I mean, you build quite a bit of resistance into your mat work Pilates as well, using bands, balls,
Yeah.
straps, etc. So we
Hold your
can
position
get.
all the time. Yeah. So you
That's
still
it.
get that without having a reformer. So
Yeah.
yeah.
Yeah. So we can still get that overload, that tissue overload through either sustained isometrics, long duration isometrics, or adding in additional resistance. So yeah. So then coming back to the sort of endurance athletes specifically, maybe what are some of the common problems that you work with? So some athletes that have come to you, you've seen them in your sports rehab clinic, and
Yeah.
you've gone, I think we need to do a block of Pilates. What are some of the sort of common problems that they might have encountered where Pilates has then been really beneficial for them?
So I see the majority of the people I see are runners. So most of them lower limb injury of some sort, and 9 times out of 10, I would say it's due to kind of poor single leg stability and hip weakness. Yeah, especially kind of lateral hip and single leg control. So that's probably the main area that's highlighted over and over again. And yes, we can load that in the gym, but Pilates is a really nice way to kind of start loading that area, especially if your training volume is really high, doing lots of other things. Especially if you think triathletes, your training volume is huge. And to turn around and say, right now you need to go to the gym 3 times a week and do these exercises that are going to make you really sore. The buy-in for Pilates is much easier. Yeah.
Because we can microdose that, can't we?
Yeah.
So it can just be little exercise snacks just
Yeah.
scattered throughout the day, can't we?
Yeah. Do these 3 before you go out for your run. And then you're not finding extra time in the day or having to go to the gym, an extra session, extra travel. Yeah.
Yeah. And again, thinking about sort of common athletes that we work with, are we just thinking about this in terms of the performance, like performance Pilates? Is it about dealing with current injuries or sort of long-term management that's going to reducing the risk of injuries? Where do you kind of feel that Pilates is sitting in that, or is it a bit of everything?
It's generally a bit of everything. Yeah. I'd say it depends. It depends where people are with regards to their other training. When you're talking about kind of, endurance athletes, are they kind of mid-block training for an event, or have they not got an event for a while, and can we, do a little bit more of the strength stuff? If somebody's injured or they've got like a niggle, like if it's not too severe, can we kind of load them with Pilates as well as them continue to do other training as well? So yeah, it ticks a lot of boxes in the clinic. Yeah, because it is, like you said, we can microdose it. We can give you a full program of it. We can make it really hard. We can make it a little bit easier. So yeah.
So you mentioned there about sort of the triathletes, particularly, you've got big training volumes, putting a lot of hours in, and same with other athletes as well. How do you kind of sell that? As how do we build this into your week without it just being yet more noise in the training plan?
A lot of the time, I'll ask people, like, realistically, how much time have you got? And how much willingness do you have? Because again, all the research says that these things are great if they're just done consistently. So do you have 15 minutes twice a week where we could just get you to do 3 exercises, and that's all it needs to be. It doesn't need to be 45 minutes 3 times a week, with your ball and your bands. It's just making it easy. Bands are great. You can pop them in your kit bag. You can have them hanging off the banisters at home, as a reminder every time you go up the stairs, do some of these, that kind of thing.
Yeah, that's it. Going to a class is often quite nice because you get some of that accountability, because it's in the diary. You've got an instructor. So again, if it's maybe somebody who's very new to it, and having that face-to-face feedback and guidance on how to improve your movement patterns, that can be very, very useful.
Yeah.
But as you say, it could almost be just a few minutes as part of your warm-up or your cool down post other workouts, can't it? Yeah.
I mean,
and it's just taking these themes.
Yeah. And at the minute, I'm obviously working online with one of your athletes who was injured. And that's worked really well for him. He's a very busy person, he can't get to see me. So we just do a session online, record it. He has the recording to be able to kind of dip in and out when he gets the time during the week. Yeah.
That's it. Yeah, exactly. Because so for context, he's in another country, so he can't be doing face-to-face on a weekly basis, but that's it. You're doing your online videos, online consultations, and the same with a lot of the online sort of classes that other people put on as well. But then you've got that recording, and you can then repeat it several times over the course of the week, which is what he does. So let's give us some examples maybe then. So what are some of your favourite sort of Pilates moves or exercises for, let's start off with a sort of triathlete then who's covering a multitude of different sporting demands. Have you got a couple of your favourite moves?
My favourite. I would definitely, so triathlete wise, I'll probably do quite a lot in 4-point kneeling. Yeah, that way you've got a bit of upper body strength and control, getting that full kinetic chain in for the swimming side of things. You can kind of get 4-point kneeling stuff for hip work, trying to replicate bike positions a little bit more. Side plank is always in there. You've got to, load in the lateral hip. And obviously, if side plank is too difficult, then we just regress that down to, hip abduction work, with or without a band. Those would be the 2 main things that I would go to.
Definitely working on the sort of lateral structure, glutes, TFL particularly, and then obliques to give you that pelvic stability. Really, really important. And that goes across with all athletes, really. But yeah, okay. And then what about a sort of a runner then? I think you've touched on this already with a lot of the kind of single leg work.
Single leg stuff in the warm up, a little bit of kind of calf and ankle mobility work, and then again on the mat, single leg bridge, side plank stuff. Yeah, just to hammer in that kind of hip stability and that single leg control.
That's exactly, because running is that single leg activity, isn't it? It's jumping from one leg to another, and it's a lot of the problems that we see in runners is that sort of contralateral pelvic drop. The hips are dropping, knees are rolling in, feet aren't stable, and spending that time just really becoming aware of that hip stability is time well spent.
Yeah, and I don't actually spend much time doing core work.
Indeed.
Yeah, I don't do many things lying on your back with your arms and legs in the air, which is typically what people, associate with Pilates.
Indeed.
Yeah.
Because we didn't do it this year, but historically with our master's students, physio master's students, we had a debate about, what is core stability? Should you do core stability? And of course, that's, we use this phrase core, but what on earth is the core? And that develops quite an interesting conversation and debate. And that has certainly been sort of criticised within the sort of physiotherapy literature. So, because it's trying to make it as functional as possible, isn't it? You've touched on that already there. Trying to, pick positions and movements which are actually functional and can relate to the task you're trying to improve on. Yeah. Okay.
I think the problem if you put somebody on the floor in that kind of, traditional Pilates position is people just brace. People push their back in the floor and they just don't move. And actually, when you're running, you need movement, you need rotation. So to take it away completely, it doesn't really work.
Yeah, 100%. So if somebody is sort of wanting to start doing some Pilates, what should they be looking for in terms of a Pilates instructor or class? Are there sort of, you mentioned the APPI, so what other kind of qualifications are there? Should they be looking at sort of the bigger classes, or should it be smaller one-to-ones or small group? What should people look out for?
If you're a complete beginner, I would generally always go for a one-to-one first. A lot of people kind of, it's a lot of money, it's what are they going to teach me? But if you have one-to-one and you just get the basic understanding, you get a few kind of basic movements, and the instructor themselves can see how you move, what can and can't you do, where do you need to improve, because there are people in my class for one reason or another, long-standing back issues, can't get into certain positions and need different props. And as a teacher, I know that ahead of time when they come to the class. It's great. I'm there. Sarah's already got her band and her ball, and she knows that she doesn't do double tabletop because she's going to do this with a band instead. It just makes it much more personalised and beneficial for the individual, I think. There's nothing wrong with going to a big class, but generally I find you tend to get a little bit lost, especially if you're a beginner. If you're a seasoned Pilates goer and you just want to have a good thrash around, it's like any class, isn't it? You go, you kind of do what you've been told, do the movements, and then you're done. But yeah, the beginners or people that have got specific needs or injuries, I would kind of veer towards one-to-one and then a kind of smaller group session. Yeah, it doesn't necessarily need to be physio or APPI, because there are some great instructors out there who've just done, gym Pilates courses. Again, it's finding the right person, I think.
That's it. It's probably the right person that you can relate to and get a good relationship with, and got the experience with what you're looking to do. And you mentioned there about obviously adjusting the exercises to the individual. So either regressing and making it slightly easier, or obviously progressing it and making it more challenging. And so it's finding a tutor or an instructor that can do that, isn't it?
Yeah.
And again, I suppose you might have actually almost answered this question. If somebody does go along to a class, how do they know that this isn't really right for them as maybe an endurance athlete?
I would, maybe that it's just a bit stagnated. I've heard, just kind of everyone's doing the same week in, week out. not kind of much progression or change, just doing the same kind of movements. Again, I like to vary what I do a lot. Yes, initially, if I've got somebody who's a beginner, we'll kind of go through those kind of stages of the exercise of the APPI kind of layout, your level 1 to your level 5. I very rarely get to level 5, to be honest. I generally sit around level 3 and then pop a bit of band in, which I just generally find people respond to a bit better. But yeah, you don't want to be doing the same thing all the time. Like, variety of movement is great, especially if you are just doing sport in one direction. Yeah, running, swimming, cycling, all in that kind of sagittal plane. We need a bit of rotation through the body. Yeah.
Yeah, exactly. And sometimes the sort of simplest and the most repetitive workouts and routines, they can be very, very effective. It doesn't have to be complicated.
No.
No. So I think sometimes instructors can try and make things too exciting for entertainment purposes and actually lose the benefit of just that consistency, that repetition, and then that very, very gradual progressive overload through adding the bands in or whatever it might be. Yeah.
Okay. I remember years ago when I was teaching in a school hall, and I had this regular group, and they'd gone from beginners to middle to like just long-term people coming and doing Pilates. And they always used to, we'd used to get a bit band out or a ball, and then, and then one week I got absolutely nothing out, and they're all like, what's this? What's she going to do? And they all found it much harder than they anticipated, and they thought, it's going to be easy because we've got no equipment this week. So yeah.
Yeah, that's it. All good. Right. Well, for anybody sort of listening to this and thinking this sounds useful, I need to maybe think about adding some Pilates into my routine. How can somebody sort of work with you or get started with you? What are your offerings?
So I work at Momentum in Ponteland in a sports injury clinic. So there I offer kind of face-to-face appointments for Pilates. I do a little kind of back pain class on a Friday. But I also do online sessions as well. So if you can't get in to see me and you want to work with me, there's the option to do online one-to-ones. We can do kind of package deals as well if we sign up to kind of a block of things. And I do have kind of pre-recorded sessions as well, which are accessible online.
Yeah, and again, you've done a quite extensive library for our HB3 athletes as well. So we got, I think, sort of over 40 recorded classes for our athletes, which is fantastic. Okay, that's been really useful. So I'll put some links for how people can get in touch with you. So links to your website and booking in with you, whether it's in person in the Northeast or online.